you doing? My name is Tristan. Today I am a student with the University of South Alabama Nursing Program. I'm going to be doing a wet to dry dressing change procedure for you today. I'm going to verify the order and the hospital's policy on the procedure. Everything looks good. I'm going to ensure all of my equipment is in place and ready to go. Everything seems good. Now I'm going to perform hand hygiene. I'm going to start by adjusting the temperature of the water to warm, wetting my hands, applying 3 to 5 milliliters of antibacterial soap. Going to wash every part of my hand 5 times, including inside of my fingers and the wrist. I'm going to be sure to stand away from the sink and keep my hands below my elbows. Now that I've washed every area of my hand 5 times, I'm going to clean up under my fingernails. Ensure that my fingernails are 1/4 of an inch or shorter. Now that they are clean, I'm going to thoroughly wash my hands, ensuring that I do not touch the sides of the sink. Now I'm going to leave the water running once my hands are thoroughly rinsed, and take 1 paper towel and dry one hand starting from the fingertips, working all the way up to the wrist. Dispose of that. Then take another paper towel, work from the fingertips up to the wrist, drying all parts of my hand. Dispose of that, and I'm going to take another paper towel to turn off the water. I'm going to dispose of that as well. 2 examples of when I would use soap and water is when my hands are visibly soiled or I come in contact with something like C. diff or MRSA. 2 examples of when I'd use antibacterial rub is when before and after contact with each patient, and when I would anytime I touch an inanimate object. Now if I could get you to verify your name and medical record number.
Jaguar Jones, 417-6352.
And I see on your medical records you're allergic to penicillin. Is there any other allergies that I should be aware of?
No.
Okay. Now I'm going to reposition the trash can to where I will be working, and I will also apply antiseptic rub to perform hand hygiene one more time. Okay, now that I'm ready to get started, I'm going to raise the bed to a comfortable working height, about waist level to me, and I'm going to reposition the patient to where they are comfortable. I'm then going to don my clean gloves and my goggles. Now that I got my clean gloves and goggles done, I'm now going to expose the wound by rolling up the patient gown and rolling down the bed sheets, allowing myself ample room to work, but also allowing the patient as much privacy as possible. Okay, now that I have everything exposed, I'm going to remove this abdominal dressing by pulling the tape towards the wound on all sides. Once I have all of the tape removed from the skin, I'm going to open the wound away from the patient. I'm going to note the drainage on the pad by the texture, amount, color, consistency, and the odor. For this example, I noticed orangish red serosanguinous fluid, about a moderate amount, a water-like consistency, and no odor. I'm now going to remove the gauze from the open wound, placing it in the abdominal pad that's in my hand, ensuring not to touch the sides of the wound as I remove the gauze. Now that I've removed the gauze, I'm going to assess inside of the wound. I'm going to assess for I'm going to assess for the size, the texture, whether it be necrotic tissue, granulate, or slough. Then going to palpate the peri wound, seeing for edema or redness, heat, or tenderness noted by the patient. Now that none of that has been noted, so now I'm going to dispose of this, going inside of my glove, going glove to glove, and skin to skin. Okay, now I'm going to prep my sterile field. Alright, I'm going to open my my dressing change tray away from my body. I'm going to remove the tape. I'm going to remove the sterile field. Now it's important to note that any part of the sterile field that's hanging off the table is now considered contaminated, along with a 1-inch border all the way around the sterile field. I'm now going to take my sterile contents and I'm going to dump them onto the sterile field in the middle. I'm now going to take my normal saline, verify that it is in date. I'm going to grab it, I'm going to palm the label, open the cap and keep it up, gently pour it into the basin, ensuring not to splash onto my sterile field. I'm going to recap the saline and set it aside. Now going to don my sterile gloves. Now for this, I will need to take my ungloved hand and grab the inside of the glove and don it onto my hand as such. I'll then take my gloved hand and grab the outside of the glove, glove to glove, and don my other hand. Now, I'm going to be sure to keep my gloves above my waist at all times. Normally, the work area would be above my waist or at waist level. This one is a little below my waist level. Okay. Now, I'm going to organize all of my medical equipment, removing the gauze and the abdominal pads to the side, ensuring to keep it within that 1-inch border. I'm now going to take my gauze and let it soak into the saline. Ensure not to let it touch the sides of the basin, just put it right in the middle. Okay. Now that I have that done, I'm going to assess the intact suture. I'm looking to see that it's intact, looking at the edges are well approximated, looking for drainage, any odor, and making sure the suture is intact. Suture is intact. Now I'm going to clean it from least contaminated to most contaminated, starting from the inside out. So I'm going to take my soaked 4x4 gauze. I'm going to wring it out, ensuring not to splash any on my sterile field. And I'm going to hold it in my hand in a way that my gloved hand does not come in contact with the patient, only the sterile gauze. When wiped down, straight down the suture line, I'm going to dispose at waist level, drop it into the waste can. Now I'm going to repeat this process for both sides of the suture line as well. Glove hand not touching the patient's skin, dispose at waist level. Wring out. Gloved hand not touching the patient's skin. One swipe, dispose at waist level. I'm now going to pat dry the suture line with a dry piece of gauze. Okay, dispose at waist level. Now I am going to pack the open wound. I'm going to take a piece of the soap gauze, wring it out, ensure not any splashes can't get on my sterile field. I'm now going to fluff the gauze to make sure it covers more space in the wound and the wound is not too tightly packed. When I place this in the wound, I'm going to ensure that I do not try to touch the outside of the wound with my hand. Wring out. Fluff back. And one more. Fluff and pack. I'm now going to cover with a piece of dry 4x4 gauze. And then take my abdominal dressing, grabbing from the outside, ensuring not to touch the inside with my gloved hand. Lay it as such. Now I will dispose of my sterile gloves, glove to glove, then skin to skin. Now going to measure and tape down all of the edges of the wound. Measure. I'm measuring to ensure that I do not waste tape and does not pull on the packaging when I go to tear the tape. Now that I have all sides of the abdominal dressing taped down, I'm now going to place another piece of tape on the abdominal dressing with the date, time, and my initials, and that's for the next nurse to know when the dressing was changed and who changed it. Okay, now that that's done, I am going to lower the patient back down to a safe height and make sure that they are in a comfortable position. I am also going to perform hand hygiene, and I'm going to dispose of all of my equipment that I used for the procedure. I am going to note when the procedure is over that the open wound, there was a orange reddish serosanguinous fluid, moderate amount. It had a water-like consistency and no odor. I'm going to note that the suture line was intact, the edges were well approximated and closed, no drainage and no odor, and the patient took the procedure quite well. No tenderness or pain was noted. Thank you.